So I had this patient, right? And she had some of that back pain, some of that stabby, pokey, irritating, acute back pain. Not terrible, but acute back pain in the low back, the low back. L4, L5, S1, that region. And that's important. Now, it just so happened she was doing something that caused this back pain. She was doing a certain action that we call sweeping, a back and forth motion with a broom. And this is similar in many ways to shoveling the snow, if you're more northern like myself, or shoveling anything for that matter, but these back and forth motions. Now, they require quite a bit of twisting of the body, a lot of side to side motion, and the body doesn't like to move linear, it tends to move in these rotational motions. Those rotational motions happen to be picked up in a few different spots. They happen to occur best, and they're designed to occur best at a few different spots. Mainly in the spine, we see it at 11 and 12, T11 and 12, L5, S1. Of course, there's other areas of the body that are sharing in this motion, but they tend to work together synergistically until they do not. Now, what you need to know about sweeping is that we tend to do it hastily because, frankly, we want to get it over with. And we don't use the best technique because we're probably not professional sweepers, let's be honest here. Most of us, anyways. I'm sure there are a few. But we also tend to do it in a flexed forward, poor technique position. And this is normal. What this does when we start to flex the spine forward is we change the position of the vertebrae, and we tend to change the tension on that vertebrae. Usually the ligaments in the back, and the muscles of course, but the ligaments are the more sensitive of the fibers. These go on to stretch that they're not normally on. And in this case, we've got just the tiniest bit of strain occurring here when we do that. When we start to add rotation to that flexion, when we combine these motions, the level of torque goes up, the level of potential strain goes up. Now, in this particular patient, we had rotation happening, but it wasn't really happening much at that 11 and 12 area. If you went down about as low as L1, L2, and maybe as high up as T8, 9, you would find that it was rigidly fixed in place, stuck, if you will, to the point where we didn't have much motion at all occurring here. And that's a problem because if it's supposed to be shared movement throughout the body, if it's supposed to be shared, the rigidities in this spine fix it, stop it from moving. And so that means we take that motion from other places. It tends to go down to the next available spot, that L5, S1 area. And because of the fact that we're already stretching that L5, S1 in a flex position, because we're already putting maybe a little bit of strain, the concentration of that force is that much more, and the strain tends to go up. The strain increases, and we're probably going to get some pain. When you start to stretch tissues, when you start to create pain, tends to be that we get an effect as well, a further effect down the line. It just so happened that in this patient, the gluteus medius and the gluteus minimus were tight and contracting. Now above it, here again in 11-12, it was more of a contracture, a fibrosis of tissues, a thickening of tissues. They were not moving. These were capable of motion, they were just refusing to do so. And this was very much of an effect, as far as we could tell, from the L4 maybe, L5, and S1 area. Because there was strain occurring through here, because there was ligaments and muscles that were on quite a bit of excessive stretch and being put through quite a bit of excessive motion, tends to react. And it reacts so on a nervous level, making the superior gluteal nerve go up in tone. And this creates less motion in the hip joint when those muscles start to contract. Now what's interesting is the hip joints are also contributory to rotation. Now they don't look like it, but remember, they work to circumduct the leg. They move in a number of different places. So when we start to stop that femur from moving, we lose some of the compensation for rotation in this area. The same could be said about the knee, easily. Flexion extension is its main motion, but that will contribute to overall body motion. And then, of course, the ankle is a great source of rotation and movement because it has dorsiflexion, inversion, and eversion. So this leg, as well, once we've fixed it, prevents the motion from occurring, prevents the rotation from being compensated for. And the lack of movement here further concentrates pressure and rotation at that L5-S1 area. Of course, we have some availability of rotation and movement in the shoulders, but it's not the same way. We're starting to lose elements, and so it's simply not enough. So as we increase the tension in the hip muscles, gluteus medius and minimus, we start to lose more and more leg motion, which further reinforces our excessive motion in the L5-S1, which further reinforces the irritation to those muscles. This is a self-reinforcing problem, a compounding problem, or what some might call a reflex loop. So we've got to get rid of these things, right? I mean, that's our job, We should want to get rid of these things somehow. Now, our third effect, number 3 on the list, is a reaction, of course. And in fact, they're probably all reactions to life and gravity and time. But this is a reaction to nerve irritation. So it's less mobile, but we wouldn't want to pull on it very hard. If we just yanked on it really, really excessively with a lot of force, we just gave it a pull, it would probably react by contracting harder. And we'd actually make the problem worse. We'd add to it. So we don't want to do that. So our first step should really be calming things down, getting it moving slowly and gradually, and just mobilizing it in a safe way to avoid further contraction, further irritation. That tends to be the safest possible thing we can do. When we get rid of that, we can get rid of some of the extra force that the low back needs to compensate for. When we've done that, we've already started to calm things down. As we get into this low back area, remember, this area needs remobilization, though slowly and softly so as not to irritate it. This area is just overused. In fact, we don't really need to mobilize it. It's already been mobilized. So what we need to do is calm it down, get rid of any irritating strain, any irritating tension we possibly can. Pushing it too hard, we're just going to re-excite it. We're just going to make it jump back up, and it will jump very easily because nerves like to guard. They do love to do that, and they do have a memory. If we do that safely and softly, we can often take care of it. Now, what is really the first and most important area, and we can see that as the cause. It caused the secondary problem, which then caused the third problem. But this first area is a chronic problem. It's been there a very long time. So we have to consider that it's rigidly held there. Attempting to force it to move would be a bad idea. It's stronger than us. It may even be stronger than bone, and this would be disastrous to attempt to break it up in a short period of time. So what we need instead of one quick thing is small things over a long period of time. So if we spend some time gradually breaking it down, reestablishing some of the normal movement, we can often find that this dissipates slowly and safely in a way that's stable, which is also very important. It can be too shocking to do too much at once. And when we can do this, when we can ensure we've taken care of what is more than likely the original problem, we'll often find that the secondary problem doesn't come back. And the tertiary problem, the reaction to the two of them, is even less likely to come back. And ultimately, that's the goal. Ultimately, we want to really get rid of it and keep it gone, because that means we've actually made a difference.